Good afternoon. Thank you for joining us today for Cancer and Heart Disease Is There a Connection? As a reminder, all lines will be muted. The presentation will also be recorded, and a YouTube link will be provided via a follow-up email. This event is brought to you by the Samaritan Cancer Resource Centers. Our mission is to partner with anyone touched by cancer to provide the support they need to live with strength, determination, and hope into the future. Please submit any questions you have to the Q&A box. Questions will be monitored throughout the duration of the presentation and will be answered at the end. A link to a post-presentation survey will be provided in the Q&A and chat box, and please take a moment to give us your feedback regarding today's presentation. Today we are pleased to have Athena Nofziger as our guest. Athena is a registered dietitian and board-certified specialist in oncology nutrition for the Samaritan Cancer Program. It is now my pleasure to turn the presentation over to Athena.
Thank you, Annie. Thank you for the introduction. All right. So today I'm just going to be talking a little bit about the connection between heart disease and cancer. Basically, I kind of format this in, I'm going to talk about risk factors for heart disease, risk factors for cancer, and how, a lot of those can be the same. That's going to kind of lead me into the sugar and cancer discussion. And then at the end, I'll get into the nutrition piece. So I'll talk about, some of the different nutrition interventions that are recommended for heart disease and for cancer prevention, and talk about, some of the similarities between those. And then just of note in regards to the heart disease, this presentation is going to be around lifestyle and genetic heart disease. I'm not going to touch on, for those of you that may have gone through cancer treatment, if you have, if any of the treatments cause some heart issues. That isn't what I'm going to be talking about today. It is around the lifestyle and genetic heart disease component. And like Annie said, please feel free to type your questions in the chat. There should be plenty of time at the end to go over some of those. All right, so just starting off real briefly with a few numbers. So there's 16.9 people in the US that have a history of cancer, and I think this is an older number. So I want to say I got this out of one of my oncology nutrition books that just published they just sent me a new one. So I haven't looked up that number again. But out of two-thirds of those people are 65 and older. And most of us are aware that as we get older, we're at higher risk for heart disease as well. And those people with a more than 5-year survival rate out of cancer are actually at a greater risk of heart disease. So I'm going to talk, all the things I'm going to talk about are going to kind of explain as to why that's happening. So I'm moving on to mutual risk factors. So I'm going to give you some information about risk factors for heart disease as well as for cancer. And so I'm going to start with tobacco, which is kind of the low-hanging fruit of those things. Most of us are aware that consuming tobacco increases inflammation. We're, taking carcinogens into our body. And the other piece is, just the DNA damage and inflammation. I just want to give you a quick definition of chronic versus acute inflammation. And this is kind of when I talk about inflammation throughout this presentation, I am talking about chronic inflammation. So if you've listened to any of my classes before, I do talk about this quite a bit, but there's acute inflammation where let's say you hurt yourself and let's say I cut my hand, it's inflamed, it's red. My body sends out, all the cells it needs to repair that. The redness goes away. That's no longer inflamed. It's healed. In a chronic inflammation situation, it's some type of damage to our body where it's not able to heal. So tobacco is a good example. If I'm consuming tobacco, it causes some type of damage. And because I continue to take in tobacco, my body isn't able to heal. So it keeps trying to heal. So it's more of a chronic inflammation. And that's kind of the same with other conditions, such as heart disease diabetes, arthritis, all of those things where your body's kind of in a constant state of trying to fix those things. Those are examples of when you hear chronic inflammation, that's what that means. Okay, so back to these mutual risk factors of tobacco. So like I said, increased cancer risk from the carcinogens, from the inflammation, and then same thing, there's damage to the artery walls from the tobacco, which causes deposits of plaque there and increases risk of heart disease. Okay, moving on to hypertension and heart disease. So first, a definition of what is hypertension. So it's also high blood pressure. And this is when there's more, basically when your blood's going through your body, there's more pressure on your blood vessels. And so your blood pressure is just consistently high because there's more pressure on those vessels. When we have damage from that, our body fixes that, and where it fixes the damage to the arteries, that's where plaque can build up. And if we have more and more plaque build up, the arteries become blocked and prevent blood flow to the heart muscle. In regards to risk of stroke, if we have blood vessels in our brain, they can become clogged more easily. And then heart failure, you know, when I think of hypertension, I think of like, you know, you're thinking about a hose, and if there's more pressure on the walls of the hose, if your heart is going to have to work harder to push the blood through. So as that happens, your heart can become enlarged, and then as it becomes enlarged, it doesn't work as efficiently. It's not able to push the blood through your body as well. So what about hypertension and cancer risk? Does that increase your risk of cancer? So there is a probable association that there's an increased risk. People who have hypertension have higher levels of VEGF. You don't need to remember these acronyms or names, just sharing some information. So that stands for vascular endothelial growth factor. And when we get kind of, you know, when we see that word growth factor in the oncology world, where, you know, it's usually means it's making things grow that we don't necessarily want to grow. So if you have hypertension, you may have higher levels of this. And this VEGF promotes blood vessel growth to tumors. So a lot of the treatments that people do for cancer, actually how they work is they block this growth factor. And so it says it blocks angiogenesis. Angiogenesis is just another fancy way to say blood vessel growth to tumors. So it is recommended to, if you're doing a treatment for cancer, to control hypertension, manage your blood pressure so that this growth factor is not higher. But just as general, you know, cancer prevention, management of blood pressure and hypertension could lower your cancer risk due to this growth factor. All right, and then moving on to cholesterol. So this will probably just be a little bit of a review for most of you, but cholesterol is basically fatty deposits in your blood vessels. And as those grow or you get more of them, it makes it difficult for enough blood flow to go through your arteries. Just as a quick review of cholesterol, like these are, you know, when you go get a blood draw, kind of the goal of where you want your cholesterol to be is triglycerides less than 150, your total cholesterol less than 200, your LDL cholesterol less than 130, and your HDL, which is the good cholesterol, you want that greater than 40. So just wanted to throw those up there since we were talking about cholesterol as a quick review. So cholesterol and cancer risks. So I started to get into this, started to read several articles, and there's all kinds of cellular pathways that show that there may be some increased risk of cancer if you have higher cholesterol. I had like 3 or 4 slides going on all this, and I took them out because I was like, this is getting too too complicated. So basically, I just wanted to bring it down to something kind of understandable. So cholesterol may influence cellular pathways that promote cancer growth. Most of the studies I saw on this looked at prostate, colon, and pancreatic cancer, and that cholesterol uptake and metabolism by cancer cells may support cell division and growth. So, you know, I think the words here are may influence, may support cell division and growth. So it's one of those things where I think we'll get more research and science as time goes on, but I can't say, like, you know, absolutely high cholesterol increases these cancer type risk types, but it may. So I think it comes back to, you know, following a heart healthy diet will lower your risk of, you know, heart disease and possibly cancer as well. Okay, so then moving on to diabetes and heart disease. So as you know, as we get older, we a lot of us tend to get insulin resistance. So that and I'm going to talk a little bit more about this, but that basically means your body's making insulin, but it's not using it. You're not getting the benefit from the insulin. And so when we have insulin resistance, this can lead to elevated triglycerides and elevated LDL cholesterol levels. Also, if we have insulin resistance and we're not using the insulin like we should, that means that our blood sugars are higher, which can cause damage to the blood vessels, leading to plaque buildup. Also, when our blood sugars are high, causes more of that inflammation that I was talking about at the beginning, and more inflammation can be vessel wall inflammation, and again, that damage can lead to plaque buildup. All right, so then how about diabetes and cancer? So there's something, you know, when our body is making more insulin, we also have this insulin like growth factor, and again, it's that word growth in there that we're not excited about. So if we have more insulin and more insulin growth factor, this can promote more cell growth and inhibit the natural cell death. So I know that cell death sounds like, well, that's not a good thing. Well, I want my cells to stay alive, but our cells go through a cell cycle and then they die and our body makes new cells. And so if this IGF-1 is not letting, you know, the old cells die and then promoting uncontrolled growth of other cells, that's where we get concerned in regards to cancer risk. Elevated insulin decreases the liver production of binding globulin, which increases estrogen in the body. And that's more related to our hormone-related cancers. Also, diabetes, especially if we're not managing it, is just an overall inflammatory condition, and having our body with more inflammation in it just kind of makes more of a happier place for cancer to grow. Okay, so I just want to give you a quick explanation of how our body processes the carbohydrates or sugar that we eat, because often when I do these and I talk about diabetes and insulin resistance, you know, then it's, well, what about the sugar feeding cancer concern? So I just want to talk a little bit about when somebody asks me that, this is kind of the angle where I try to explain, you know, it's not that straightforward. All of our cells in our body need glucose for fuel. So that includes our healthy cells. So I just want to show you this diagram to kind of explain how this works. So we have this blue Pac-Man here that's eating a strawberry, and then it goes into the bigger circle, which is kind of an example of your stomach, and which breaks down and then goes into your digestive system and gets all the strawberry gets broken down into glucose. So we want that glucose for fuel in our body. So the next piece is there's a red arrow, and it's wanting that glucose to go into that smaller circle, and that little knob on that small, so the smaller circle is a cell. And so the little knob on that circle is your insulin receptor. And in order for the glucose to get inside of your cell for fuel, we need the pancreas to make some insulin basically to unlock that cell so that the glucose can go in there. If we have excess glucose, then it goes and gets stored for fuel for later use. So if you have a long time between your meals and you need some glucose, then you've got some stored up and your body will get that into the cell when you need it for fuel. So that's real basic of how, you know, what our body wants to do and likes to do in regards to fuel for our body. All right, so what about cancer cells and sugar? So one of the reasons where there's this concern is that cancer cells have more insulin receptors than normal cells. So that means that, you know, the cancer cells can use up extra glucose. So yes, that does sound like that leans towards the argument of, well, you know, the sugar feeding cancer concern. But I think the thing to remember is that your healthy cells also need that glucose for fuel. And then, you know, also that, like I said earlier, that insulin that, you know, your body makes to get the fuel into your cells can tell cells to grow. So that's where we get that insulin-like growth factor. So more than just the cancer cells, you know, having more of those insulin receptors, more is the concern about this insulin resistance. So these little diagrams here on the bottom are, one is like here on the left is how the sugar is getting into your cell for fuel, and the one here on the right is insulin resistance. And I'll talk a little bit more about those. But so when we eat something, goes through that whole process of digestion, we have blood sugar in our bloodstream, which is normal. Our pancreas makes insulin in order to get the blood sugar into the cells. Well, when we have insulin resistance, that's not happening. And so your pancreas is making more insulin to get the blood sugar into the cells. So we have more of that growth factor that we're concerned about. The sugar is unable to enter the cells for fuel. So your pancreas keeps making more insulin to make the cells respond. And so then we have this hyperinsulinemia, high insulin in the body, which makes more of this insulin growth factor. And then the blood sugars keep rising, which increases inflammation. So you've kind of got two things going on there. And so basically in these pictures, this one here on the right that's showing insulin resistance, we have the cell, and you've got that light blue box, which is the insulin receptor. And the dark blue boxes are the insulin, which are trying to unlock the cell so that the sugar can get in, but they aren't the same size anymore. So the insulin can't unlock the cell. And so you've got insulin out there, and you also have sugar out there. So that's kind of what's happening in regards to insulin resistance and cancer risk. All right. So please, if you have any questions for me about that, more about sugar feeding cancer or diabetes and heart disease risk or cancer risk, please feel free to put them in the Q&A in the chat. I'm going to move on to talking a little bit about obesity. So I think most of us are aware that obesity increases your risk of heart disease, and for several reasons. We've got, you know, the diabetes risk, elevated blood pressure, higher cholesterol, insulin resistance, increase in inflammation. And then there is a lot of information out there that shows that there is an increased risk of cancer, several cancer types with obesity. So I have this chart here for you. This is from the American Institute for Cancer Research, and they do this continuous update project. And basically they're putting together kind of all the science in regards to lifestyle and cancer risk. And they do a lot too on, you know, certain nutrients or food groups. Like, you know, I've got a couple more of these charts where it shows like fruit and vegetable intake and cancer risk. And so the one I'm wanting to show you here and I'm hoping it's not too blurry, but you see this column over here on the right where it has the red and orange boxes. So those correlate with probable increased risk and convincing increased risk of cancer. And the purple box on the top, which they're connected with, is adult body fatness. And so you can see over here on the left, there is a list of several cancer types that you're at higher risk for if we have more fat tissue. Okay, so then just touching on this insulin resistance again. So as we, most of us we gain weight as we get older, and, it's inactivity, lifestyle, excess calorie intake, excess sugar intake. And so again, kind of that same things going on. So the more sugar that we eat causes us to gain more sugars and calories that we eat, causes us to gain weight, causes more insulin resistance at the muscle cell. Insulin resistance leads to elevated triglycerides. And then if we have more insulin circulating in our body, it actually tells your body to store more fat. So you've got kind of a cycle going on there. So just wanting to show, that, there's increased risk of heart disease with obesity as well as cancer risk. Okay, so then I want to touch on hormones and weight management because, I do get like the question a lot in regards to cancer risk and heart disease. Like, well, what are the foods I specifically need to be eating? And it comes down to the bigger picture, and this is why. Our adipose tissue or fat tissue causes insulin resistance, increases inflammation. There's a hormone that our body makes that is produced by adipose tissue, and this increases this uncontrolled cell growth I was talking about, inhibits apoptosis, which is a fancy word for that natural healthy cell death, and then also promotes angiogenesis, which was the blood vessel growth to tumors. So the more fat tissue we have, our body makes more of this leptin. There's another hormone that our body makes called adiponectin. And this hormone decreases insulin resistance and inflammation and promotes that healthy cell death. We have less of this hormone when we have more fat tissue. So when people ask me, what are the foods I need to be eating, it kind of goes back to the bigger picture. Overall healthy diet, exercise, work on reducing the adipose tissue, improving blood sugars so that you have less of that insulin response, reduces your inflammation. If you are working on reducing your adipose tissue, it increases, improves your immune function. You have an improvement in your cholesterol, improvement in blood pressure. So both of those pieces all together, which increased cancer risk and heart disease risk, are going to improve with weight management. And not so much, I talk a lot too about, like, yes, some weight loss, but really changing that ratio of, adipose tissue to muscle tissue. So working on, combination of the healthy diet, cardiovascular fitness, and increasing muscle mass. So like I said, eating a balanced diet to promote weight management. And then, I have here, don't focus on the superfoods. I always tell people, like, do all the other pieces, healthy diet, exercise, and then add in the superfoods in addition. So, when you hear like, okay, should I be eating lots of blueberries? Should I eat lots of kale? Yeah, in addition to all the other healthy diet pieces. All right, and then just kind of, I wasn't really sure where to fit this in the presentation because I'm getting to get now into the nutrition piece, so it feels a little clunky, but I did want to touch on alcohol. So mostly because, when I've worked a lot more with cardiac patients, there's the recommendation of it's okay to have, 1 alcoholic drink for men, 2 alcoholic drinks a day for men, 1 alcoholic drink for women. and that there may be a reduced risk. And so I just have here, they're more in like observational studies, not well-controlled studies. And then, you know, what's a serving of alcohol? You know, that's a big part of that recommendation. And then excess alcohol intake increases your triglycerides, can cause hypertension, cardiomyopathy. And so, you know, I just like to make that point when we talk about, yes, it's recommended to have alcohol to prevent heart disease. There's some caveats to that. In regards to cancer risk, alcohol increases most risk of most types of cancer. It's just oxidative stress to the body, the toxic effect of alcohol. There's an increase in estrogen. It interferes with your folate absorption, which is needed for just healthy DNA. Okay, so then back to those just alcohol recommendations. So the recommendation is the same, 1 drink per day for women, 2 drinks per day for men. But light drinking does increase your risk of breast cancer, esophageal. And then for cancer survivors, most of the recommendations are to abstain from alcohol consumption. And I'm not saying this to be scary. I just like to share that because I do get asked that quite a bit. Like, is it okay if I have an alcoholic drink? And I think if you're, you know, now and then having something at Christmas, that's not what we're talking about here. We're talking about the daily consumption, which increases your risk. And so this is that same chart. Over here on the right is those red and orange and yellow boxes, and it's correlated with alcoholic drinks, and just showing you that it does increase risk of several cancer types. Okay, so then moving on to more of the wellness and nutrition piece, I'm going to touch on exercise for a minute. You know, and more than just, yes, you need to exercise to lose weight, but there's a lot more benefit there that you get in regards to health, for your heart as well as cancer prevention. If you've gone through treatment, exercising helps to increase your muscle mass. I already talked about, you know, trying to increase your muscle mass to reduce the adipose tissue, weight maintenance, improvement in cholesterol, improvement in blood sugar. Exercise helps to decrease that inflammation. If you're in treatment, it can reduce some of the side effects. Some people have issues with lymphedema after they go through treatment, and so some exercise can help with that. It helps to improve those hormones I was talking about. So you have a decrease in that leptin, an increase in adiponectin, reduction in estrogen. So for those that are more concerned about the hormone-related cancers, exercising consistently can reduce estrogen. Also, all the other pieces, reduction in, you know, fatigue, anxiety, depression, improvement in sleep, improved quality of life. And those are all important, other important factors in regards to your heart health and cancer prevention health. All right, and then quickly, I just want to talk about what's the difference between exercise and activity. So physical activity is any movement that we do throughout the day that uses our skeletal muscles, uses energy. So, you know, whenever you get up, walk around, do a little laundry, walk into work, take the trash out. All of those things are physical activity. But when we're talking about, you know, reducing some of these health risks, there also needs to be the exercise portion. And so that is planned, structured, repetitive, intentional movement. And the goal is to improve and maintain your physical fitness. So we say that exercise is kind of a subcategory of this physical activity, but you need both. And then, you know, when we talk about, okay, when I say you need to do some cardiovascular fitness as well as increasing muscle mass, what does that mean? And so I'm going to give you some numbers, but this doesn't mean that everybody is able to do these numbers. You need to start wherever you're at. I just like to give them to you so that there's something I don't know, something number to grab onto instead of just like, you need to do cardio and strength training. Well, what does that mean? So the definition of cardiovascular exercise, it should be performed for 150 to 300 minutes per week at a moderate intensity. And your heart rate should be about 130 to 150 beats per minute. You know, I don't think everybody's going to know that, but if you have some of those fitness trackers, you do know your heart rate. If you are at a fitness level where you're doing more high intensity fitness, then that recommendation is cut in half. It's 75 to 150 minutes per week with a high intensity heart rate of 150 to 170 beats per minute. Again, I just want to clarify that not everybody is able to do this 150 to 30 minutes per week. It's something to work towards. And this is kind of just the definition of what cardiovascular fitness is. The resistance training, this should be 2 to 3 days a week on non-consecutive days. That allows your muscles time to build up and heal. You want to start your strength training with 5 to 10 minutes of some type of warm up, and then completing each exercise 10 to 15 repetitions for 2 sets. And when I say that, I am not meaning like, you need to find a gym and start throwing around heavy weights. This really, again, is where are you at fitness wise? Does this start with doing some type of higher intensity yoga or higher intensity Pilates to build up core strength? And then you can maybe start with some light weights, or, is there some type of other muscle building exercise that you enjoy doing? This isn't, just a standard, you need to go to the gym and lift weights, and also starting where you're at. So you may not be able to do the 10 to 15 repetitions. You need to start with where your strength level is at now. Okay, so I'm going to move on to the nutrition piece. I'm going to give you a quick rundown of a few of the diets that are recommended for heart disease. So this is just the standard cardiac diet. So really it's to eat a variety of fresh, frozen, and canned vegetables and fruits without high calorie sauces, added salts and sugars, replacing more of your high calorie foods with fruits and veggies, getting more fiber in. So, eating more whole grains, choosing your poultry and fish without skin and cooking them in healthy ways. And then if you're eating red meat, looking for lean cuts of red meat. Eat a variety of fish at least twice a week so you get more of those omega-3s. Low-fat dairy products are included. Reducing the hydrogenated vegetable oils and trans fats in your diet. And, that used to be, we would talk about that a lot, but really that's more of your processed foods that have those in there. So if you're eating more fruits, vegetables, whole foods, and cooking with, olive oil and canola oil, you're not going to be getting the hydrogenated oils. Cutting back on your sugar sweetened beverages, foods with added sugars, and then the sodium, 2,300 milligrams a day of sodium is the recommendation for a heart healthy diet. And then if you do have high blood pressure, lowering it down to 1,500 milligrams per day. But a lot of times people can get good blood pressure control at the 2,300. We already talked about the alcohol recommendations for a cardiac diet. All right, so then this is the TLC diet. So this is a therapeutic lifestyle change diet. This is more somebody who's really wanting to lower their cholesterol. And so this is more restrictive, is a bit more work because there's kind of more tracking going on. But really, the definition of this diet is less than 7% of your calories from saturated fat. So you don't need to remember all these numbers, but there's for every gram of fat that we eat, there's 9 calories. And so somebody's really wanting to focus on this is going to, figure out how many grams of saturated fat is in their diet and how to get, less than 7% of your daily calories from that. Less than 200 milligrams a day of cholesterol, 25 to 35% of calories from total fat. And then other things you can include, more plant stanols and sterols. These are found in plants, 10 to 25 grams of fiber per day. So getting more fruits, vegetables, beans, barley, oatmeal, oat bran, psyllium. And then getting in enough calories to maintain a healthy weight, and the same exercise. You should get at least 30 minutes of moderate physical activity, such as walking, on most days of the week. All right, and then you may have heard of the DASH diet. So this diet is specifically recommended for people with high blood pressure. So it is based on an eating plan of fruits, vegetables, low-fat dairy products, whole grains. It's high in fiber, low to moderate fat, rich in potassium, calcium, and magnesium. And part of the reason that it's lowers your blood pressure is one, this reduction in salt, but also getting in those other nutrients, the potassium, calcium, and magnesium. Oh, good. I thought I had written out what the acronym meant. So DASH stands for Dietary Approaches to Stop Hypertension, and it has been proven to lower blood pressure, reduce cholesterol, and improve insulin sensitivity. So all of those things, reducing blood pressure, cholesterol, improving insulin sensitivity, is also going to decrease cancer risk. Just to kind of put it in like a chart format, I like charts and numbers. So if we're let's say we're aiming for a 2,000 calorie diet. So that's getting in 7 to 8 servings of grains, which sounds like a lot, but it's more about knowing like what is a serving of grain. So, a piece of bread is a serving, a third cup of rice is a serving. So if we're having rice for dinner, we're going to get up to that 7 to 8 servings, no problem. 3 to 5 servings of fruits, 4 to 5 servings of vegetables, that's quite a bit. And then 2 to 3 servings of non-fat dairy foods. And then adding in your nuts, seeds, legumes 4 to 5 times per week, and your fats and sweets are limited. Okay, the other one that's big is the Mediterranean diet. Also, I talk about this as an anti-inflammatory diet. So what is it? So it's gonna kind of the same thing here. Lots of vegetables. If you eat meat, eating smaller amounts, including your dairy products like Greek yogurt, plain yogurt, smaller amounts of cheese, seafood twice a week, getting in a vegetarian meal 1 night a week, using your healthy fats such as extra virgin olive oil, nuts, peanuts, sunflower seeds, olives, and avocados, more whole grains, and then choosing more fruits for dessert to lower your sugar intake. So this is another chart from the American Institute for Cancer Research, that continuous update project. And so what I'm wanting to show here is kind of the benefit for eating fruits and vegetables, because that was kind of the common theme in all of those diets there that I talked about. So this green column here, this light green, so the light green, the definition is there's a suggestive decreased risk of cancer. And so it correlates at the top here in the purple with your non-starchy vegetables. So eating more vegetables. So getting in, broccoli, cauliflower, tomatoes, salads, all of those non-starchy vegetables, there's suggested decreased risk of several cancer types here. If you look over here at lung cancer, it's got 4 light green boxes. So eating things with beta carotene, carotenoids, vitamin C, isoflavones, all those good antioxidants may decrease risk of lung cancer. There's some light green boxes under the fruit intake for lung and esophageal. So just kind of wanting to make the point in this chart, it is showing also that increased fruit and vegetable intake lowers cancer risk. And then, we do hear a lot in regards to heart disease, like you need to limit your red meat intake, limit your processed meat intake to lower your cholesterol, lower your sodium intake. And some of this is the same for cancer risk. So these yellow over on the right are some yellow columns. And so that's under your red meat and processed meat. And so the research is limited, but it's suggested that there's an increased risk of several cancer types with with red meat and processed meat consumption. And I do want to make the point that these studies look at consumption of those foods every day. So going back to just a healthy diet, variety is key. I think red meat can be in there one night, then go over to chicken, and then get your seafood in twice a week, and a couple of vegetarian meals, getting more of your, beans and lentils in for protein. And it's the daily consumption of those things that really is more concerning over, okay, these yellow boxes say I can't ever have meat, and that's not the point I'm trying to make here. All right, and so these plates are also from the American Institute for Cancer Research. So, they call it what they have, the New American Plate. That's kind of their nutrition recommendation. And so I've got some plates here to show you. So they have like this, what they call the Old American Plate, which has your steak and potatoes and peas on it. And then moving to a transitional plate where you've got, half your plate is now green beans instead of peas. Your meat portion is smaller. You're having a grain instead of potatoes. And then taking it like another step, you can see, there's chicken here, and you've got 2 or 3 servings of vegetables, and like a, wild rice, or this, stir fry option where there's a couple servings of vegetables and chicken and wild rices. So again, really the guidelines are kind of the same, looking at all of those different diets. So lots of fruits and veggies, whole grains, lean proteins, nuts, lentils, legumes, beans, low fat dairy products, and be mindful of added sugars. So they all kind of have the same, in the end, it's kind of the same recommendation. So any of those would be good interventions for a healthy heart as well as cancer prevention. This graphic is also from the American Institute for Cancer Research, and there's just kind of an overall package recommendation instead of, okay, I have to avoid these specific foods and eat these specific foods. It's the same thing. Manage your weight, move around, whole grains, limit your consumption of processed foods, high fat foods, limit consumption of red and processed meat, limit consumption of sugar sweetened beverages, limit consumption of alcohol. So just kind of the whole package again. These are some of the resources that I use to put the presentation together, so just wanted to share that. And if you want more of this, if you like to delve into more science things and you want to look up this continuous update project, bottom right corner here is the website. So it's dietandcancerreport.org if you want to learn more there. All right, thank you so much for listening. I'm going to hand this back over to Annie, and if you have any questions for me, please get them in the Q&A box, and I'm happy to answer them.
Thank you, Athena. All right, so we're going to just give folks a couple minutes to get their questions written in. I'd like to go over a few points of information here. If you'd like to obtain more resources or information about cancer, please feel free to contact us at the Cancer Resource Center by phone, email, or by visiting our website. The Cancer Resource Center provides monthly virtual education, and if you're interested in any upcoming events, please contact us to subscribe to our newsletter. Let's take a peek here. Do we have any questions?
I do see one about copper. And I'm going to have to be totally honest. I don't know the answer to that, and I'm going to have to look into that.
Increasing copper might reduce hormones, but what about copper interactions with heart disease?
Yeah, I don't know the answer to that, so I'm going to have to look into that.
Did you hear the question, Athena?
Yeah, can you still hear me, Annie?
Okay, I'm sorry, I didn't hear your answer. I think that was an issue on my end.
Are you able to hear me?
Yep.
Okay, all right. I just said that honestly, I don't know the answer to that, and it is something that I would have to look into. I don't know the answer about the copper and heart disease.
Okay, that's something we could follow up with. If someone wants to email us with that question and give us your information, we can definitely follow up with you. Doesn't look like we have any more questions at this time, but if any should arise, please do email us and we can follow up with you individually. Again, the survey is in the Q&A and chat box. If you could please take a moment to complete that for us, we really appreciate your feedback. And please keep a lookout for the follow-up email that will include a link to today's recording. Thank you again for joining us, and I hope you all have a great day.